concerns about his stances on abortion access. Before we begin, I would like to state that these physicians are speaking as individuals and with the committee, and not necessarily on behalf of any employers or other organizations with which they're affiliated. So we ask that you please respectfully only refer to them in any coverage as they introduce themselves on this call. And thank you in advance for being mindful of that. Without further ado, I will introduce our first speaker, Dr. Teresa Rohr.
Thank you. Teresa Rohr Kirchgraber. I'm a professor of medicine and certified in internal and adolescent medicine. Today, former President Donald Trump is speaking at a rally here in Georgia. As physicians, we're paying attention to what Mr. Trump says about abortion. The last time he discussed abortion at a rally, he told the crowd that if he won this election, Americans would never have to think about abortion. But just last week, he claimed a national abortion ban was off the table, only to do 180 moments later saying, "We'll see what happens." As a physician, this kind of back and forth is deeply concerning. Mr. Trump's inconsistent messaging shows a lack of understanding about the real life impact abortion access has on women's health. For my patients, abortion isn't a political talking point. It's access to essential health care. Frankly, his messaging on abortion has been all over the place. Earlier this year, Trump called Florida's 6-week abortion ban a terrible mistake and said it was too extreme. But then in August, he seemed to support a ballot measure to repeal the ban, only to reverse himself and say he would vote against it. He has even said he would veto a national abortion ban, except weeks earlier, he refused to commit to that during the presidential debate. How can anyone feel confident about their healthcare access when the person claiming to lead the conversation can't even keep his own position straight? We must look past his flip-flopping statements and at his record. And his record is appointing 3 Supreme Court justices who overturned Roe v. Wade, leading to state abortion bans like ours. The harm caused by Trump abortion bans is already happening. Women in these states are experiencing worse health outcomes, including higher rates of pregnancy complications and maternal mortality. States like ours with bans are seeing a drop in medical residency applications, further limiting access to essential care. Physicians are leaving these states, and that affects everyone in need of health care, not just those seeking abortions. Donald Trump's wait-and-see approach to a national abortion ban is not an option for patients who need care now. Delays cost lives. These bans are causing real harm every day, and we can't afford to let politicians play games with patients' health. Women in Georgia deserve clear, compassionate leadership, not contradictory statements that leave their health care hanging in the balance. Thank you. Now I'd like to introduce you to Dr. Zeman.
Thanks, Dr. Rohr. I'm Dr. Mimi Zeman, an OBGYN for more than 30 years from Atlanta and a specialist in family planning. I speak today on behalf of my patients who can't afford to see what happens with a national abortion ban under a second Trump presidency. State abortion bans are dangerous. A national ban would be catastrophic. We'll wait and see is not a plan. Mr. Trump talks about leaving abortion to the states as if that's a good thing, but these state-level abortion bans are harming and punishing women right now. That's why doctors are speaking out today, and why we've backed a mobile billboard circling Mr. Trump's rally venue today with that message. As OBGYNs, we deal with the consequences of our state's abortion ban, made possible by Trump's Supreme Court picks every day. Patients with high-risk pregnancies, those facing severe complications, as well as those dealing with the aftermath of a miscarriage. Forcing these women to carry pregnancies that are not viable or delaying care because of political interference is both cruel and dangerous, as is depriving women of essential health care, which is what abortion care is. Healthcare decisions should be made by the patients in consultation with their physicians, not dictated by politicians with extreme agendas who know nothing about healthcare. I've had patients come to me confused, scared, and unsure if they can even get the care they need because of the constantly changing legal landscape surrounding the ban. I've had patients ask me if they will be arrested for traveling out of state to seek abortion care. The fear of prosecution is real. For that matter, Doctors are confused about the state laws also. Physicians are also facing time behind bars for the crime of providing life-saving treatment to their patients. As physicians, we aren't able to do our jobs in the best of our ability. We're not able to fully uphold the oaths we took to care for our patients, respect their autonomy and privacy, and to deliver the evidence-based care we trained for. And this undermines the trust between patients and physicians. Patients deserve timely, compassionate, and appropriate care without the interference of politically motivated bans. If we don't take a firm stand against these dangerous bans, we will continue to see more unnecessary suffering. The inconsistency in Donald Trump's platform on healthcare only adds to this confusion, making it clear that under his leadership, women's healthcare in Georgia and across the country will remain under threat. It's time to stop playing politics with people's lives and bodies and restore trust between patients and their doctors. Thank you. Now I'd like to turn to Dr. Polo.
Dr. Polo, you need to unmute.
Can you hear me now?
Yes, perfect.
Okay, great. I had to move. Anyhow, I'm Dr. Polo. I'm a family practice physician from rural Northwest Georgia. This is my 41st year in practice. I'm board certified in family practice and do also hospice and palliative medicine. I've seen a lot of changes in healthcare and very concerned that the Trump presidency could threaten that, just like threatening abortion care. Abortion is only one piece of the healthcare puzzle. Trump and his allies have also threatened to repeal the Affordable Care Act and the Inflation Reduction Act. It's no secret that we have a long way to go, but Georgians and all Americans have access to the ACA much more so than they've had in the past. Unfortunately, Georgia is not a participating provider, and we don't have as good participation as we could have had in other states. The ACA requires healthcare insurers to cover essential health benefits that keep people healthy and ward off expensive complications down the line. It requires health plans to cover critical health services such as outpatient care, mental health, substance abuse treatment, rehabilitation, diagnostics and lab tests, preventative and wellness services, and more. This also includes 100% coverage of mammograms and colonoscopies. We have saved many lives due to decreases in deaths from colorectal cancer over the last 10 to 12 years. The ACA ensures young people who are going to school and starting jobs can still stay on their parents' healthcare plans until age 26. I know my two sons were on my health insurance until they were able to graduate from college and graduate school and not have to go without health insurance at that time. The ACA has helped more women access affordable contraception, maternity care, and postpartum care, which are more important under a state abortion like we have now in Georgia. The Inflation Reduction Act has built on this progress, empowering Medicare to negotiate lower drug prices for 10 commonly prescribed drugs. With more negotiations on the way, I believe within a few years, every year they can negotiate 20 different drugs. And now, recently, Eliquis and Xarelto, which are been life-saving drugs to prevent strokes and clots, will be reduced almost by 50% in cost for Medicare patients starting in 2026. Next year, though, in 2025, drug costs for seniors will have a max of $2,000 out of pocket. That will also help our seniors, especially my lower income seniors that we see in our county. It caps insulin with seniors for $35 a month. I think everybody's heard about that. And hopefully in the future, a Harris administration will actually make that available to all patients, not just Medicare patients. We should be protecting and strengthening these cost reducing measures for both patients and also for the federal government. Georgia should be expanding Medicaid under the ACA like other states have done. There are 10 states that have not expanded Medicaid, but for all the other states that have, an estimated 27,000 lives have been saved. If all states had Medicaid expansion, another 13,000 lives would have been saved since 2010. The other issue we have is rural hospital closing. In Georgia, 9 rural hospitals have closed since 2010. That's the third highest rate in the country. Medicaid expansion might have prevented these closures. I also read another article that says Medicaid expansion would bring in $1.2 billion in a couple of years to our state that we are not getting now to help support both healthcare and our rural hospitals. Trump has made it clear he wants to repeal the Inflation Reduction Act. Like on abortion, he flip-flops on the Affordable Care Act. For years and years, and even earlier this year, he argued that the ACA should be repealed. Then he wanted to improve it, but he only had concepts of a plan to do so. Our patients can't plan around concepts. Our patients who need affordable insulin and prescription drugs can't wait and see what Trump will do with the ACA and the Inflation Reduction Act. Our patients who need life-saving abortion care can't afford to wait and see what Trump will do on a national abortion ban. Trump's healthcare plans are too dangerous for our patients and could reverse the gains we've made since 2010 to improve the lives of our patients. I want to thank Anika and Lori for inviting me to speak today, and I'm going to give you back to